Good afternoon, everyone. Thank you for joining us today for our Health Links. And I'm the Community Programs and Events Manager here at HealthLinks, and I get the pleasure of working with our team to put together these monthly webinars to help you and your teams gather more resources to build a culture of health and safety in your workplaces. These webinars are designed to relate back to our benchmarks within our HealthLinks standard, and today our benchmarks focus on three different areas, which are our safety policies and programs, workplace assessments, and organizational or evaluation. So we're very excited to have our presenter, Lauren Pierpoint, here today, looking at how you can utilize data and prevent some injuries, specifically in the ski industry. But before I present her and hand over the discussion, I'd like to go over a few housekeeping items with you all. So first, we're going to be keeping everybody on mute throughout the presentation. That's to help reduce any distractions from sound or any technology complications. So if you have a question throughout the presentation, please feel free to use your chat box. It should have popped up on the right-hand side of your control panel or screen when you logged in today. We'll field those questions as Lauren is presenting, but then also make sure to save about 5 minutes at the end to go through them individually as well. We will be recording the webinar today, and we will share the link with you in a follow-up email so that you can watch it again or share it with any coworkers that you think would find this information valuable. So be on the lookout for that email, and we'll also be providing the slides and Lauren's contact information so that if you have specific questions that she can't get through today, she can connect with you on an individual basis. And then finally, we'll have a quick survey that pops up for you. If you don't mind just taking 2 minutes of your time to complete that and let us know what you thought of the presentation today, and let us know what else you'd like to see in future webinars, we would greatly appreciate it. So with that, let me introduce our speaker for you. Lauren Pierpoint is a PhD candidate here at the Colorado School of Public Health, and she's currently studying sports injury epidemiology. Before she pursued her doctorate, she earned her master's degree in integrative physiology here in Boulder and served as a volunteer ski patroller for many years. So she has combined her love of skiing with her interest in epidemiology to research injuries that occur during winter sports activities. Her career goals include working with sports organizations to design, evaluate, and improve injury prevention efforts. She's very passionate about what she does, and I know that she's very excited to be here today, so I am going to pass everything on to her. Lauren, go ahead.
Thank you, Michelle, so much for that introduction, and thank you everybody online listening and taking the time out of their, I'm sure, very busy schedules to learn a little bit about what we're doing here at the School of Public Health. So I grew up in Colorado. I was a ski patroller for several years, and so I'm like very personally invested in the subject, and I hope that comes across during the presentation. But full disclosure, I am an epidemiologist, so I love data and I work with statistics for a living. So warning, there are a lot of numbers in this presentation, but I try to provide graphics and interpretations along with them. So if you're a decision maker or are bringing information to decision makers, you can decide which charts I present that you think are incredibly boring and never want to use again. Or you can decide that, hey, this is a great graphic, maybe I want to share it with my team. And so I always want to start by saying, by better learning how injuries happen, we can prevent them in the future. And that is the cornerstone of what we do for epidemiological research. And if you're listening, I probably do not have to tell you about the many benefits of winter sports. There's the benefit to the individual. We all get a lot of personal joy and satisfaction and health benefits to participating. And then here's a graph of all our lovely ski resorts in Colorado. And I've had the privilege of working with many professionals in the industry who truly have joy in what they do and have joy in bringing this experience to others. And there's also the bottom line. I'm sure you're aware that the outdoor industry, or the ski industry, brought $4.8 billion into the Colorado economy in 2006. And there are millions and millions of people that participate in skiing and snowboarding annually. And this is a nice graphic put together by the National Ski Areas Association, which shows how many participants you have per year over time and breaks it down by activity. And so there are close to 10 million people in the US that ski or snowboard each year. And that adds up to almost 55 million skier visits annually. And that's just to US ski resorts. So that's a lot of people who participate. And in Colorado, 1 out of every 4 of us participates in skiing. And so with a lot of people participating, it means a lot of people are at risk. That's a basic fact. Every time you go up to have a fun day, there's some element of risk involved. And the goal of epidemiologists like myself is to keep as many people safe as possible without discouraging participation. Like I said, with participation, though, does come a little bit of risk, and I want to share with you why we should care about this problem. The annual burden of injury is high. Given the high number of participants, there are a lot of injuries that happen, even if the rates of injury are not as high in other areas of sports, say contact sports. We're unsure what the total burden of injury is that's contained within this triangle, but we do know about some of the more serious injuries. So this injury pyramid shows severe injuries on top, and at the bottom it goes to less severe injuries. So you have your near misses where no injuries at all, injured but do not seek treatment, and people who see ski patrol. And we don't actually have good estimates for how many across the US happen. We do know that there are an estimated 600,000 doctor's visits in North America annually. About 100,000 present to the emergency room, and then 5,000 people are hospitalized, and there are 44 deaths. Like I said, large burden of injury, but this is also a product, just a lot of people participate in these sports. It's not that skiing is, inherently dangerous and we should exclude everybody from participating. And there's a lot of numbers on this slide, but I just want to there's one take-home message that you guys probably already know. So we know about the burden of injury now, but what do our skiing and snowboarding injuries look like? So the single take-home message from this slide is that skiers are different from snowboarders and they should be treated differently. They have very different patterns of injury. And these tables come from a really nice study that I'll suggest that you guys go read about, conducted in Sugarbush, Vermont over 18 seasons, which is really impressive. And it's data collected from the base of a clinic, the base of the ski resort at a clinic. This is not the only study that has taken place over the past few decades, and I could talk your ear off for an hour at least about all of them. But instead, I prepared a slide for you. It's the next slide to come back to and look at on your own time if you so desire. So I'll go over it very quickly, but this will give you resources to go look. If you're interested in a certain risk factor and you're interested in some literature, you can go and refer to this slide and say, okay, maybe I want to know about the risk of being a beginner or what happens on blue runs. You can go to these references and look up what's available. There are existing injury prevention programs out there that I want to highlight because some of them have been very, very, very successful, and some of them have experienced questionable success. And so we can learn from what has been done in the past going into the future. And one of the best injury prevention strategies that has come across ever for skiing is the invention of releasable bindings. That happened in the 70s. That was before I was skiing or born, but it cut the injury rate in half. From 13 to 7 per 1,000 skier days, and that is huge. That's one of the most successful prevention efforts. And that was an industry prevention effort. Helmets. this has been a great success story over the years. 80% of people now wear them after decades of advocating for their use. And I feel like this is a victory on multiple levels. It's a victory at the industry level, at the resort level, and at the individual level to get this to happen. Wrist guards are a great injury prevention source, but they're not heavily used by people. You rarely see someone, unless their parents are making them wear wrist guards on the slope, even though they decrease odds of wrist injuries. Education is highly promoted, yet its effectiveness is not clear. And what do I mean by education? It's signs, campaigns, things that you do at your resort to try to get people to exhibit safe behaviors. And so I'm not saying don't do education. I'll talk a little bit about that later, but its effectiveness is not clear in every single circumstance. And then finally, some existing prevention efforts around strength and conditioning. And its effectiveness is not clear in recreational athletes, but when you take it and apply it to employees, it reduced the ACL incidence significantly. And unfortunately, this particular program was scrapped due to financial reasons, but it had a significant effect on ACL incidence, which I think is a great success. So despite our best prevention efforts, rates of injury haven't actually changed that much in 30 years. There has been a slight decline, but overall, not a lot has changed. You can see from this graph, which has I've adapted from Sheely et al. In 2014. It's a study conducted by the National Ski Areas Association, which I love. They conduct a study every 10 years, which selects 25 representative ski resorts to report injury information from ski patrol incident forms. And I love that the industry is doing this, but I'm really disappointed that the rates aren't going down as much as some of us would like to see. And some have argued that they have, quote, stabilized over time, but I kind of disagree with that. I don't think anybody truly believes that we've bottomed out and there's just nothing more that we can do. There's a long way to go, and I think there are some promising efforts happening now that may show decreases. And so while these prevention efforts exist, a lot of them have a couple things in common. And what is that thing? They rely on implementation at the individual level. So this is a really simple graph that supports or that represents a lot of literature out there that says the more individual effort is required, the effectiveness of your intervention goes down. So the more someone has to do on their own, the less likely they are to be successful at that intervention. And if you remember from a couple slides back, a lot of those were individual interventions apart from the bindings, which eventually the whole ski industry switched to. So what can we do? This brings me to the study that I'll be talking about today, which also happens to be my dissertation project. And this is grounded in some scientific areas. And I am arguing that most analyses so far, or aspects of prevention, have left out one key factor, and that is the environment. We don't hear a lot about prevention efforts that include the environment, even though you can't separate the environment from skiing and snowboarding. And so the reason I'm showing you this slide is to ground my analysis in a scientific framework if you're on the research side. And both say that injuries are a product of not only who you are as a person, but the environment which you are in. And so in conclusion, you just can't escape the environment. So when we think of prevention or even studying injuries, we should include it. But if that slide didn't do it for you and you're like, oh, well, what do I actually do? This slide gives you a first step. So this is the public health model that we apply to solving any problem. It doesn't have to be an injury problem necessarily, but we apply to any problem. And it's the cornerstone of injury prevention or solving this problem is starting with the definition of the problem. And while that may seem simple, a lot of people skip this step. And so I want to just highlight that each one of these steps are very, very important, but you can't get to the next step without first defining the problem. And I'll spend a lot of today doing that and hopefully convince you that it's worth it to collect your own data to identify areas of that you might want to improve upon. After you do that, you can identify risk and protective factors. You can pull those out of the data. Those are two very easy steps. The next steps are a little bit harder. Developing and testing prevention strategies take a little bit more effort, and they should be evidence-based, and you should have a mechanism for testing their effectiveness. And then assuring widespread adoption, that is the hardest phase, making everybody participate in your intervention or encouraging everybody to participate in your intervention, even if you can't mandate it. So again, these steps are simple, but each is extremely important if you want to go about solving an injury problem. So my study asks a very, very simple question. And how do intrinsic and extrinsic factors interact to influence injury rates and patterns? So this graphic essentially says that injuries are a product of intrinsic or internal or personal characteristics and extrinsic or environmental factors. And so what I mean by intrinsic is it's who you are. How old are you? What's your gender? What's your ability level? Are you wearing a helmet? Are you a skier or a snowboarder? And where are you from? All of those are going to affect your injury risk. And then you have our environmental circle that says you can't escape the environment, so we should definitely take a look at it and consider it when we're looking at injury prevention, not only for recreational athletes, but for employees too. Our employees are exposed to the environment, so we really need to take care of them as well. So how am I doing this? I am lucky enough to have the extreme fortune of working with one of the largest resorts in Colorado, and I want to emphasize that this was a resort or clinic-initiated study, and so I was very lucky to hop on as their epidemiologist / statistician. And so the people who I'm looking at are those injured at a large Colorado ski resort during 2012-13. And so I'm providing this year of data because that's the only year of data that I have that's very complete. I got other data last week and haven't had time to analyze it because it was a lot, but I'm very excited, and I'll have you guys stay tuned for when all the analyses are done. Injured as the direct result of skiing or snowboarding. So I don't include people who were walking in the parking lot and fell and broke their arm. I don't include people who were tubing or sledding or snowshoeing. It's just those who were skiing or snowboarding. And they had to have a musculoskeletal injury or an internal traumatic injury. And then they needed to be evaluated at the clinic center at the base of the resort. And so I'm very specific about my study population, and if you're going to collect data, you should be too. It's very important to decide who you want to look at and who maybe is going to be excluded from your study if you want to make inference later on. And so how do I get these people? Well, if you are injured, on the left side, we have a skier who has injured their knee. 10 to 27% of injuries that occur may bypass treatment on the hill at all. And so that means that they don't even see ski patrol. They get hurt and they ski down by themselves and they go home, or maybe they go to their doctor, but we don't know. The other people are taken down by patrol or ski down by themselves, and a small proportion go directly to the clinic without seeing patrol first. But most people are interviewed by patrol and we have information about them. And then finally, they're evaluated by a physician and who has an X-ray machine, which is very nice for definitive, clear diagnoses. So The take-home message here with this diagram is that no matter what, we have to understand that we are underestimating the true burden of injury because not everybody ultimately gets evaluated by a physician. So my sources of data. Where do you get your data if you want to do something yourself? Well, I got my data from clinic records. You can get your data from ski patrol records too. It depends on what you want to look at. I wanted to look at clinical outcomes, but you can look at outcomes or diagnoses by ski patrol too. So I get injury outcome and patient demographic from these clinic records, and it's retrospective chart review. And I have to say that this was very difficult and time consuming. These are pen and paper records that I, one by one, went through and extracted the necessary information needed from it. I do not recommend this. So going forward, if you are thinking about doing data collection, I would highly recommend going digital. Having an electronic medical record keeping system is the way things are going forward and very, very useful for data collection and analysis in the future, so you don't have to hire someone or go through decades worth of clinic records yourself. The ski patrol records that I received included skier ability and slope difficulty. That's where that information comes from. And this was limited data, but it was really nice because it was delivered to me in an Excel file. I did not have to extract that information. And then weather information, you can pull from SNOTEL sites. And this is online, it's publicly available data, and there are sites all around Colorado and the country that provide temperature and snowfall and humidity and a lot of great different information. And you can go to the NOAA website, or the National Oceanic and Atmospheric Administration, and get this information. And it's fairly easy to pull. And then resort management has been really nice to work with. They've provided the number of people who skied each day at the resort, which is very helpful, and some weather information. I'm very excited about what they've provided because not all researchers have access to that information, and that means we can calculate rates of injury by environmental exposure. So were more people injured on snowy days versus non-snowy days, or hot days versus cold days? There are a lot of comparisons you can make. Okay, if you're a researcher, you'll probably like this slide. If you are not and don't necessarily care about the nitty-gritty of analyses, please feel free to ignore this, but the last bullet point will be what is important to you, what is significant, and what matters. But, so I am transparent. I did all my analyses in SAS. My bivariate approaches are just looking at one predictor and one outcome. I use t-tests, chi-squares, and rate ratios, like you normally would. For my multivariable approaches, and this says I have multiple predictors and one outcome. So I'm not just looking at the effective age on injury, or if you're a skier or boarder on injury. I'm looking at the entire picture of the person and its effect on injury rates and patterns. And those are, I use logistic regression, something called multinomial regression, and negative binomial regression to evaluate these. But what I'll present to you is odds ratios and rate ratios that tell you about increased or decreased risk for certain injuries. And then finally, if you see a p-value of less than 0.05 or a confidence interval not containing 1, those are what I've considered statistically significant. And so that's what you should pay attention to if this is what's important. I do want to remind everybody that this is preliminary data. This is 1 year worth of data, and this may change with time. If you look at a few years later, a few years before, things might look slightly different. And so this is advocating for, if you haven't already established your baseline, get your preliminary data now so you can compare going forward. So when I say I wanted to look at intrinsic factors and how they affect injuries, and I'm sorry, all the graphics are of skiers. I'm a skier, so that's what made it in here. No offense to snowboarders or anything. So who you are as an individual, how does that affect your injury risk? And this is a slide that shows how I analyzed all my variables. So if you're wearing a helmet, that's yes or no. Gender is binary, residence. I was very interested in looking at people who are from Colorado and people who aren't from Colorado, because Colorados kind of have opinions about visitors and their effects on injury rates. So I did actually want to look at that. I looked at ability, if you're a beginner, intermediate, or consider yourself to be advanced or expert, and then if you are a skier or a snowboarder. And those are all intrinsic factors, or factors related to the person that may affect injury. And then our extrinsic factors are all the environmental factors of interest. And now I realize that there are so many more that you can look at, but these are the ones that I have access to. If you are interested in other extrinsic factors, there may be a way to get those data either from patrol or from other publicly available sources, but these are the variables that I have. Snowfall, and I've categorized it into less than an inch versus greater than an inch for previous comparisons to previous literature. We've got temperature, base depth, skier density, and so this is the number of participants that are skiing on any given day divided by the number of open acres. And the hypothesis behind that is that if you have a lot of people in a small space, they might run into each other more often and produce more injury. So we wanted to know if that affected any rates or patterns of injury. And then we also looked at time of day, the morning versus the afternoon. So those are all our environmental or extrinsic variables. And our outcomes of interest are whether or not someone was transferred, and this is a proxy for severity. So if someone comes in and they need further medical care and they need to be transferred or evaluated at like a level 1 trauma center, those are considered more severe than those not transferred. They're treated at the clinic and then they're discharged home. Mechanism of injury is another outcome. We want to know how these people are being injured. And so it's categorized into fall, contact with an object, collision, non-contact, or other. And falls are just someone fell down and they hit the snow. And that is how they injured themselves. Non-contact is if I'm skiing and I made a turn, and during that turn I blew my ACL, but it wasn't caused by the fall. That's classified as non-contact. Contacts with objects, those are trees, stumps, and man-made things like fences and bamboo, anything that patrol puts up. Body regions are classified as follows, and diagnoses are classified as follows too. So what does this particular resort look like? So a reminder that these data are from 2012-13, so things could look very different now. But in 2012-13, we had over 1,100 injuries that year. Most were to skiers, fewer were to snowboarders. Skiers were older than snowboarders. Skiers were equally male and female. A lot more males participate in snowboarding. And snowboarders tended to be more beginner than skiers. There was no difference between skiers and snowboarders from whether they were out of state or not, or no statistical significance. And most people wore a helmet. This number, I'm sure, has increased from 2012-13, but it's an important variable to look at and see how that has changed over time. And what we found is what we know, which is heartening. So we don't have, drastically different injury patterns from other resorts or other published papers. But I want to warn you, when you do conduct your study, when you compare it to other papers, you have to remember, like, are they using clinic data? Are they using ski patrol data? Are they using self-report? And choose an appropriate comparison group to see if you are different. How do people get injured? Snowboarders, man, they just fall. They're falling all over the place. I think you guys, every time you go skiing, you see them sitting on the mountain, right? Just kidding, maybe. But skiers are more likely to run into objects and collide with other people. So that's not good either. But the distributions are significantly different. So skiers and snowboarders do injure themselves in different ways. Now, what about our extrinsic variables? So according to Ski Patrol, these are the terrain in which people are getting injured. And I wanted to bring your attention to the highlighted in yellow boxes. Skiers, most everything happens on the blue slopes. There are a fair amount that happens on the easier slopes too, but half of them happen on the intermediate ones, as opposed to snowboarders, which they're happening on the very easy slopes, probably because they're more beginners, and in freestyle terrain or in terrain parks. Very few happen on experts-only terrain, which is good because only experts should be there. And a small proportion, but it's there, happen either loading the lift or unloading the lift or falling off the chairlift. Other environmental factors that we looked at include snow, and these are just so you can get an idea of the amount of snow we had this year. So 1.5 inches on average daily, although that can be from 0 to 15 or 24 inches depending on the year. Almost half the days had snow accumulation of more than 1 inch. And the average base depth, again, which can change a lot, is about 50. You can see temperature, acres open, skier density, and then the only difference between skiers and snowboarders that we found was time of day. And it's a small clinical difference, I think, but skiers tended to be injured more frequently before noon, while boarders tended to be injured more frequently, or less frequently before noon. So while most injuries occurred after noon, a greater proportion of ski injuries occurred before noon compared to snowboarders. And I don't know, maybe skiers get up earlier, they come in earlier, maybe they're not morning people and fall more. I don't really know why. It is a significant difference, but who knows if it is clinically meaningful or not. So those are all our univariate or bivariate comparisons. We're just looking at one variable related to whether you're a skier or a snowboarder. And what I wanted to do is consider the big picture. So if we take all these variables and put them into a model, if we consider them all at once, what is still associated with our outcomes of injury? And so this is what that analysis kind of visually looks like. All these variables are in a model, and we are looking at, okay, how does being a skier, snowboarder, or age or temperature affect how you will get injured, controlling for everything else? And for mechanism of injury, the only thing that came out as significant was if you are a skier or a snowboarder. So in the presence of all the other variables, it matters what type of rider you are. And I want to say also that I have big, long tables with all of the output from SAS that I thought would put everybody to sleep if I shared them. But I'm happy to share with them later for those who are interested. And when I say skiing and snowboarding is significant, that means there was a global or overall effect with a p-value less than 0.05. And then what you can do is look a little bit more closely and see where those differences lie. And we see what we kind of found univariately too, is that skiers are more likely to collide with objects. If we looked at being transferred, we see residence and age are associated with the likelihood that you'll end up at a level 1 trauma center. And actually being local was a risk factor, but it was small, the effect size was small, and age, being older, was a risk factor, but the effect size was very, very, very small. So more work needs to be done to see what may be associated with severity of injury. If you look at variables associated with body regions, We have, whether you're a skier or a snowboarder, again, your gender is very important, and so is your age and your ability. And these are all intrinsic characteristics. So it's who you are as a person that is affecting what injuries you see. And frankly, I'm really surprised that we didn't see more of effects on the environment. I thought for sure we would, but maybe when we add more years of data, something we'll discover something. But right now, this is what we're showing. And so if you want to look at specific areas for injury prevention, we can go in and we can pull out individual odds ratios. And so I'll go through this really quickly. Skiers are more likely than snowboarders to injure their lower body compared to their trunk. So that's not surprising. We know that skiers they injure their knees and they break their legs. Males are more likely to injure their upper body, so shoulders and wrists. Younger people are more likely to acquire a head injury than older people versus just injuring their trunk. And intermediates are more at risk for hitting their head than beginners. And so in terms of injury prevention, if we're going for targeted specific prevention here, we might want to go after the younger intermediate participants instead of just all the intermediates or all the younger people. Let's make this actually targeted. And same thing here, our variables associated with diagnosis, most of them are intrinsic except for mechanism of injury. And I'll only go through mechanism of injury right here, but collisions are more likely to result in concussions compared to just falling. So if you run into someone or if you run into an object, you're more likely to become concussed as opposed to if you just fall and hit the snow. Same thing, we see a really strong effect with age. So that was a lot of data that I just presented to you. But if you take nothing else home when you go back and look at these slides, take home the fact that all the variables in red remain significantly associated with their respective outcome, controlling for all other variables. And when you zoom in on that, you can identify certain very specific subgroups to target that make up a large proportion of your injured population. And I want to say, again, I was very surprised that we didn't find more of an effect on the environment, although we will in a future analysis that it'll come in 5 minutes. Although snowfall in this, I'll say was very, very, very close, but it did not reach statistical significance. I didn't feel comfortable putting it in there. And as a reminder, this analysis can apply to the worker as well. The ideas and the principles are the same as if you had an injury data set, an injury-only data set with your workers. But say you're less interested in the individual and more interested in the bigger picture. So instead of going on asking the question, how can I prevent injuries at the individual level, what if you want to know, how can I reduce injury rates at my resort? What is going on? And so instead of taking a magnifying glass to each person, what we can do is zoom out. And one of the variables that was collected with all of this clinic information was residence. We actually have the zip code, the specific zip code where people were from. And I thought the results of this, just by running some simple frequencies, were very interesting. So you can see on this map that people come from all over the United States. And some states have no visitors. There wasn't anybody from Utah who got injured here, but maybe they're not coming here. Maybe they're staying in Utah and enjoying the lovely power that they get there too. But some of them, the states in black that you can see, Texas and Kansas, they make up a large proportion of our injured population. But our Texans and Kansanites, Kansians, people from Kansas, are they at higher risk? And you don't actually, I can't answer that right now. If 20% of the out-of-state population comes from Texas, then no. Or if 12% of the total population of your skiers at your resort comes from Texas, then no, they're not at an increased risk of injury. But say Texas only makes up 5% of your visitors each year, but they're making up 12.5% of your injured population, that tells you something about their risk. Then you can say, okay, it really is those people from Texas, but really we don't know, because if there are a lot of Texans, we would expect them to show up in the clinic. And if we zoom in to back into our resort level, we see that there's 1,000 injuries that occurred in 2012-13, a little over 1,000. But this ranges, this varies widely. And more people see ski patrol only and don't make it to the clinic. So, and there are a lot of people who get injured and bypass the clinic. So this injury number is likely an underestimation of the true burden of injury, but it's more serious injuries that did require clinic attention. And that's what we're looking at. There was the better part of 1 million skier visits that year, but again, it ranges really widely from less than 500 to more than 14,000, which to me is just mind-boggling, and I hate to think of what the lift lines are like on days like that. And the overall rate of injury is 1.33 per 1,000 skier visits. And so remember back to that slide I showed you in the very, very beginning of the presentation, that showed that skiers in that study had a 2.5 per 1,000 skier visit rate. And when I say skier visits, I really mean participant visits, skiers and snowboarders. And the reason, so you might conclude that, oh, my resort is a lot safer, or, oh, what I'm doing is reducing injury rate. Well, remember that I presented information that was using ski patrol report forms. And so if you're going to compare yourself to other resorts or other sectors, even other sports, you really need to be sure that you have an appropriate comparison for your injury and for your denominator data. But our rate of injury varied from no injuries per day, which was always really nice as a ski patroller, especially if it was snowy, to 4.4 injuries per 1,000 skier visits per day. So a really simple injury prevention you can ask yourself at your resort or your town is, how do my rates compare to other resorts? But results don't mean a whole lot for prevention until you have a comparison group of yourself, so you can compare yourself to yourself over time or to other resorts. And I would argue that there should be some data sharing, de-identified data sharing mechanisms so that we can all do this. So you can answer the question, if I'm higher, why am I higher? Is it my demographic? Is it something that I'm doing? Why am I higher? Or if I'm lower, why am I lower? Why are my rates of injury lower? What can I share with the rest of the industry to help them bring down their injury rates too? So let's zoom in a bit more. And this looks like a seismograph. I know it's a little bit messy, but I graphed injury rates, the rate of injury per 1,000 skier days on the y-axis, and then you just have time on your x-axis. So this is what a year looks like in terms of daily injury rates. And what you can see, certain days just pop out at you. You can easily identify days where you can expect to have high injury rates, especially if you see this over time. So check it out, opening day. That may not be surprising. Everybody's really excited. They want to get out there. We call that like the white strip of death, right? Which is, I think, over exaggerated, but I generally wait until the second week to go skiing. And then you can see your holiday weekends. There are spikes on Thanksgiving, President's Day, Martin Luther King Day, and then around New Year's as well, around Thanksgiving. So automatically you go, okay, these days, here are some easy targets. I can make efforts to decrease rates of injury on these days, and that will have a large effect on my rate of injury overall. But I've told you that I think that we don't include the environment enough. So let's get to the environmental analysis and what you can do if you're interested in how the environment might affect injury rates. So what if the days with lower rates are actually the snowy ones? What if the days with higher injury rates are actually the warm ones, and that's really what's contributing to it? So you can compute rates of injury very easily, and this does negative binomial regression analysis, but don't be intimidated by that. This is calculation of rate ratios, and in the first two columns, you can calculate those in Excel by hand. You do not need a PhD to do that. And then if you have a statistical package, you can calculate adjusted or a friendly neighborhood biostatistician or epidemiologist who will do it for you. You can calculate adjusted rate ratios. But let's go through this table and exactly what it means. And let's look at the first two columns and what's highlighted. These columns say that the less snow you have, the higher rate of injury you have, or conversely, the more snow you have, the lower your injury rates are. And then I've written out an interpretation at the bottom of the page so we can put this into perspective. Rates of injury are 20% lower on days with more snowfall. And then something that I found very, very, very surprising, I was convinced that on more crowded days where there are more people per acre, that there would be higher injury rates, and man, we saw the opposite. And this was persistent when we adjusted for everything else, and when I left it as a continuous variable too. There's a correlation between participant density and injury rates, but it's in the opposite way that I expected. And I would love to hear some thoughts on why you think that is. I have theories. Maybe it's early season and people are being more careful. Maybe they're skiing slower because there's just too many people around and they're being more safety focused. I don't know. But what you can get out of this slide, if you know what your rates are annually or per day, and you know how many people you can expect in a day and how the weather is, you can easily predict your patient load for the day or how many people you think will get injured at that resort on that particular day. And so you can do some predictive assessments very, very easily and simply if you have just a little bit of information. And this can be used for injury prevention as long as you establish the baseline and track your progression over time. So that's all the data I'm going to share with you. And what did this analysis add? I thought it was fun to do statistics. So personally, that's what it added to me, but really, what did this add? So I showed that many bivariate relationships actually hold. And that is good news for people who maybe aren't a fan of big fancy statistics, because that means for some variables, it's okay not to control for other variables. Those relationships are real and not dependent on other variables. And so what we've shown for many years does actually hold up. But some factors matter more than others. And if you're going for targeted prevention, it's in your best interest to consider the person as a whole. Snow matters. Oh, don't we all know that? Snow matters for so many reasons, but here it also matters for injury rates. Rates of injury were higher on days with less snow. That has a lot of implications, and we are all concerned about the amount of snow we get each year and that it's declining. And I really want to know why rates are lower on days with more participants per acre. That really surprised me, and I don't know if it's behavioral or environmental, but I'm going to do a lot of thinking about this. I do want to say, though, that this is 1 year worth of data, and so taking this as gospel, or this is what you would find at your resort, is harmful. So more years of data needs to be looked at to make any definitive conclusions, but if this holds with more years, I'll be very interested to see what happens. We saw that out-of-towners make up the majority of our injured population, and they come to Colorado and they provide us with, they help provide us with an economy. If you live in a tourist town, you know how valuable tourists are, and I think that it is our responsibility, partially, to keep them safe. The last thing I wanted to point out is that your burden of injury is really easily identifiable if you get to the right data sources. Simple rate ratios can be computed in Excel, and they're very interpretable, and you can take it to your administration or take it wherever it needs to go and tell a compelling story with not a whole lot of data. And like with anything that happens in research, there are limitations, and there will be limitations for if you want to conduct your study and you just have to work around them. This is a preliminary analysis. It's 1 year worth of data, and my results may depend on how I categorize the variables. So, and if you categorize your variables differently or even the same, and you do the same analysis, you might find something different, because not all resorts are the same, which is why I think comparisons are so important. And this was an injury-only data set, and that's really important to know. I can't tell you who's more likely to be injured overall, and that is a huge, huge question. I can tell you that among the injured, these are the variables that affected how you were injured. But if you don't have the uninjured demographic, it's very hard to say who's at more risk for getting injured in general. How you can fix this is you can look at your customer base, because likely you want to know who's buying tickets or who's visiting your town, or for researchers, you know, who your reference population is, who your true comparisons are. And if you can get distributions from your customer base or from your marketing team, that probably would be a good place to go for this. You can then start making statements about risk. There are so many variables also that we didn't measure. It's impossible to measure everything, but there are some important ones, like visitability, grooming, alcohol. I think grooming may have a lot to do with this, but I don't have that data, so if you do, I encourage you to use it. This also has limited external validity, and what that means is that these results may not apply to every resort out there, but the principles apply, the data collection applies, and you can take these to wherever you are and collect your own data using the same methods, but you might find something different. Time-consuming extraction. Oh yeah, I do not recommend pen and paper, but if that's what you've got, that's what you've got to work with. EMRs are wonderful. And another big limitation, this analysis is still in the first 2 stages of the public health model. I haven't developed or tested any prevention strategies, although I'm working with the resort and the clinicians at the resort, going through these data and saying, okay, what can I do? And so what we're doing is picking our winnable battles. And I think that this is very, very, very important for injury prevention. We cannot solve anything. Well, actually, we could bring the injury rate down to 0 if we just say don't ski, but that's ridiculous. You know, we're not going to say that. But what are winnable battles? They are problems that you can make significant progress on, but in a short amount of time. And I don't know about snow. I put snow with a question mark here because I think that this should constantly be a battle, arguing for, telling your senators about climate change and bigger issues and water resources. Very, very, very important. But we also identified some easy victories. Holiday weekends. So you can probably get your injury rates down on holiday weekends if you target your prevention to those people who are getting injured more often. Out-of-towners too. Terrain parks, we identified a lot of injuries occurred there. And time of day, most injuries happen in the afternoon. And so if you go in and educate people about the importance of staying hydrated, taking breaks, you might be able to start to see that go down. And I think that fact sheets and comparisons can be really, really valuable tools. So making good graphics that people can relate to about injury prevention can be really helpful. And then you have to ask yourself, like, what is your acceptable level of risk? What problems are you willing to solve? And so that's what I like to call winnable battles. And you can, once you identify these, use the public health model to start addressing it. And then you can get into the third and fourth stages of that model. And if you get there, that's a wonderful, wonderful victory. To close out, I wanted to propose some future directions for those wanting to collect and use their own data. I suggest sustainable data collection, and that means electronic. Electronic is better than paper, and having a database manager is really, really helpful too, someone who knows what they're doing. And then I can't emphasize the importance of establishing a baseline. That's why that's in bold. So you can say, what are my trends over time, and does my intervention work? And without a baseline, it's very, very hard to tell. So if you implement an intervention but have nothing to measure it against, how do you know if it works? And interventions require a lot of time and a lot of money. Share and compare. This is a pretty sensitive subject. I want to be very, very sensitive. Resorts don't necessarily, and I totally understand why, like you don't want to release your injury information, but it might be great to, I would suggest having a common source data injury database that is maybe de-identified, where you can compare yourself to other resorts, not knowing what those other resorts are. And your data are never identified either. But that way, there can be some sharing and comparing without feeling like you're going to get hammered, legally. And then employee and slips, trips, and falls. As a ski patroller, I would say the majority of employees that I treated slipped in the parking lot on ice. It is a huge, huge problem, and I would love to see. I'm sure that a lot of efforts are going on right now. I'm absolutely sure that people are addressing that problem. But you can use these steps of establishing a baseline, how many slips, trips, falls you have, identify targets and winnable battles, implement an intervention that's evidence-based and targeted. Mostly targeted though, like perhaps you need designated walkways for people to bypass the parking lot so they don't walk on ice. That could be an intervention, and you could see if that decreases your rate of injury. And then evaluate, evaluate, evaluate. Evaluate the effectiveness of your intervention by repeating step one. Go back to your baseline. So future directions for research in general include reducing the incidence of sport-related injury, and TBI is a great concern. I always want to advocate for more research as well. And injury prevention can not only work at the individual level, but at the population level as well. And so I want to thank you so much for your time today. And if you have further questions, I am happy to answer them. And please contact me. This is my email address. I'm at the Colorado School of Public Health. And I want to thank you so much for your attention.
Wonderful. Thank you so much, Lauren. That was really great. And whether you work at a ski resort or work in a different industry, I think there are a lot of key pieces that Lauren highlighted that you can take back with you, whether you're evaluating and implementing a health program or a safety program. The public health model that she presented works everywhere, from first identifying the problem and identifying the risk, and then developing strategies. That's the first thing that we always recommend to our employers that we work with, is go to your employees first and look at the data and see what's happening, and then build a program from there. Don't just assume that you know what's happening and develop a program that way. So thank you again. We do have just a few minutes for some questions, and I know there is one on here asking for some clarification on your snow description on your rates ratio slide.
Sure.
Can you just redefine the less than one versus greater than one?
Sure, absolutely. I'm so sorry that this wasn't crystal clear. So what this the RR stands for rate ratio. And so what this rate ratio is comparing is the rate of injury on days with less than 1 inch of snowfall, that's on your numerator, compared to rates of injury on days with That's actually flipped. Oh, I'm so sorry. Thank you so much for the clarification, and I will fix that slide before we send it out to everybody. Those arrows should be reversed. Thank you so much for pointing that out, the very astute observation.
Yes, thank you. And thanks for that question. But if anybody else has any questions, please feel free to type them in the chat. And then again, we'll provide Lauren's contact information in the follow-up email so you can contact her directly as well. Lauren, my last question for you, you mentioned a little bit on how the ski resort will be utilizing this data. Do they often, how does the ski resort actually take this back to inform their decisions? Can they make the decision to require all young skiers to wear helmets or things like that, or close the resort on days if there's not enough snow? Are those types of decisions that they are able to make using this type of data?
I'm sure they could. So I am not in on those meetings yet, but these are the types of data that could help answer questions. If you are considering closing or mandating a helmet use, you want to have evidence that that would be an effective area for prevention. So the answer is yes, these data can help. I haven't been in those meetings yet.
That's great. Thank you. Well, I do know that we're out of time for today, so thank you again, everyone, for taking the time to join us. And Lauren, thank you for providing some great information and data for us. This is very helpful for our thinking and framing how we move forward from here. So again, thank you all. We'll send out all this information and resources for you to use for your own organizations, and we'll be in touch. Have a wonderful afternoon, everyone.